An ethmoidectomy is a procedure that removes infected tissue and bone between the ethmoid sinuses to create larger sinus cavities. Ethmoidectomy, intranasal, anterior. The physician removes diseased tissue from the ethmoid sinuses. Local anesthesia is injected into the nasal mucosa. The physician retracts the middle turbinate anteriorly, exposing the sinus opening. A small curette may be advanced into the anterior ethmoid cells. The physician uses the curette to remove any diseased tissue of the anterior sinus, and allows the sinus to drain. Ethmoidectomy, intranasal, total. The physician removes diseased tissue from the anterior and posterior ethmoid sinuses. The physician retracts the middle turbinate anteriorly, exposing the sinus opening. A small curette is used to remove the uncinate process in the bone. The physician may advance the curette into the anterior ethmoid cells. The physician uses blunt forceps to open posterior bony cells. Ethmoidectomy, extranasal, total. A curvilinear incision is made between the nasal dorsum and the medial canthus of the eye. Dissection is carried to the medial orbital bone. A bony window is made through the lamina papyracea bone, exposing the lateral ethmoid sinus. The physician removes all diseased tissue. The external skin incision is repaired with a layered closure. Maxillectomy, without orbital excineration. Surgery to remove the maxilla is called a maxillectomy. Maxillectomy can be used to treat cancer of the oral cavity, inside the mouth, nasal cavity, inside the nose, and / maxillary sinuses, pockets found in the bones of the face. The physician removes a portion of or all of the diseased maxilla. Incisions may be intraoral or may include skin incisions such as the Weber-Ferguson approach. Dissection is continued to expose and isolate the planned bony excision. The physician uses drills, saws, and chisels to fracture the maxilla from the mid-face. The fractured maxilla and adjacent tissue are loosened and removed to free margins as determined with intraoperative tissue specimens sent to the pathologist for immediate microscopic examination. All sinus mucosa is removed. Exposed bone may be covered with a separately reportable split-thickness skin graft. A splint may be placed to obturate, block, the mouth from the surgical area. All skin incisions are repaired with a layered closure. Maxillectomy, with orbital excineration, and block. The upper eyelid incision is dissected to the periosteum of the superior orbit. The maxilla is retracted downward, so the physician can visualize the optic nerve and blood vessels. The optic nerve is severed and the vessels are ligated. The maxilla, adjacent soft tissue, and orbital contents are removed in one specimen.